You're listening to episode number 24 of the Nightingale podcast. In this week's episode, I am doing a solo show all about nursing clinicals. And nursing clinicals is a topic that we are hyped up to talk about because, first of all, we happen to dread clinical more than we actually should, or we get so stressed out of the thought of trying to impress or live up to certain expectations that we might just be putting only on ourselves. But before we dive on into this week's juicy episode, I want to share with you and highlight our reviewer of the week. This week's review comes from Melissa Renee RN. She says, 10 out of 10 would recommend. My favorite nursing podcast. Love the variety of guests. Keep up the great work. Thank you so much, Melissa, for leaving your review. As always, it is so beneficial to hear your feedback, and this is a great way for us to spread the word about the Nightingale podcast and just share these nursing journeys with other people. If you are loving the Nightingale podcast and it is something that has really made an impact in your life, I welcome you to leave a rating and a review. And especially to share it with your nursing friends and get the word out there so that as many people as possible are impacted by these amazing stories and just tangible advice for nurses, future nurses, and anyone who's interested in this profession. Hey friends, welcome to the Nightingale podcast, a podcast for nurses, future nurses, and, well, anyone interested in the nursing profession. I'm your host, Dakota Falkowski, RN, BSN, and DNP student. Join us each week as I interview nurses from all areas of the nursing profession to uncover nursing opportunities that you may have not known even existed. You can expect to be inspired and maybe even a little bit motivated. The goal of the Nightingale podcast is to encourage you to think outside of the box, step outside of that comfort zone of yours, and reach for a fulfilling and unique nursing journey. So let's dive in and check out this week's guest. You never know, they may just have your dream job. I am really excited to talk to you about nursing clinicals today because this is a topic that I am right in the thick of with everyone else. I'm currently in my nurse practitioner clinicals, which are all the same as undergrad clinicals or as a certificate clinical. It's stressful and I feel you, and I just want to offer some advice and some wisdom about how to get the most out of it, how to decrease your overwhelm and your stress and anxiety over it, and just some things to expect. So I just kind of wanted to get started with an amazing quote about comparison. So comparison is something that I think we all have a really difficult time with when it comes to being a nurse, or being a nursing student. So comparison with our classmates when it comes to tests, or when it comes to just performance, when it comes to being a nurse and comparing yourself to what your fellow nurses are doing, or comparison to someone who maybe started at the same time as you, or comparison in all multitudes of life. And if you're an entrepreneur in someone else's business, or even in like this whole social media world, we are so obsessed with comparison and comparing ourselves to one another and others' nursing journey. So I wanted to start with talking about comparison and giving you a really good quote about it, because comparison when it comes to clinicals is so real. It is so real to compare yourself not only to your classmates and what you think that they are taking out of clinical, the experiences they're getting, or their performance versus your performance, or comparison to other nursing schools and what their students are performing like. So comparison is something that is so real, and it prevents us from just showing up and really being the best student and the best performer that we can be, because we're so focused on everyone else that, one, we're not really living up to those expectations of others because we're comparing and then we're in this comparison game. And also, we're missing out on just living out to what our own unique identity is when it comes to being a student and our own learning kind of needs and experiences. So I love this quote. So this quote is from Bob Goff. It says, "We won't be distracted by comparison if we are captivated with purpose." So how often do we go in and compare ourselves and do this comparison game and just forget what we were there to accomplish? So, if we are able to shift our mindset to a place of purpose and we start every single clinical day or every single day of school or every single shift in a what is my purpose here? Is my purpose to be the best student, to listen, to make goals for ourselves throughout the day, or is our purpose to kind of get lost in this world of what is everyone else doing? Because I've been there for undergrad and I've been there for grad school, where you're just looking around at others and you're like, oh well, so and so got to insert a Foley today, which this is totally real. I don't know how many of you are with me on this, but especially when it comes to those skills, you're like, oh, well, so-and-so got to go to the OR today, or they got to see a procedure, or they got to insert an IV, or they got to take more patients, or they got the better, so-called better nurse preceptor. We allow this comparison to overwhelm us, and we don't show up fully. So lose the comparison and just commit to starting every single day with, what is my purpose today? How am I going to show up? And set your goals, set your intentions, and that really will be the first step to making you successful in your clinical experiences and just showing up and getting the most out of these experiences. So that is a really good starter too for us. So I'm going to chat a little bit about what is clinical for those of you who don't really know what I'm talking about. So clinical rotations are both in certificate programs. I did clinicals with my nursing assistant certificate. You do it with medical assistant, with LPN, RN, NP. Every single kind of healthcare, most healthcare degrees and certificates in general just have clinical rotations that go with it. So as far as undergrad, what that typically looks like is when you are becoming an RN or an LPN, you have core clinical classes. So you have your classes that, for instance, for my program, we had Med Surg 1, then Med Surg 2, then we went on to pediatrics and mother baby. So you have your different core classes, and typically you have a clinical that goes along with it, where you are showing up and actually working on those skills that you've learned from the class and kind of using that material. So this looks different for every program that is out there. I know there are a lot of programs who are shorter, where my program for my nursing degree was 2.5 years. We did clinical for pretty much 2 of those years. And it was just 1 day a week, a full 8-hour day, and each one was a different site. So we went to labor and delivery, we went to a med surg floor, we went to and did a psych rotation. So this looks different for everyone. I know some programs, they have clinical twice a week or longer days. It just all kind of depends. And if that's something that you are trying to take in consideration with when you're applying for nursing schools, I suggest you just ask them what their setup is for that. And then as far as for graduate school, so this again is different for everybody, but for mine in particular right now, for my graduate program, I am doing a DNP program that is pediatric nurse practitioner, and I am actually in primary care. So all of my clinical rotations are in the primary care setting, and then I am able to choose one clinical rotation where I am in a specialty. So I'm able to do one specialty rotation. Most of those are outpatient. However, as a PEDS primary care nurse practitioner, you can work in the acute care setting. It just all kind of depends on what jobs you're applying for. So that's just how my setup is now. Again, they kind of go with your core classes. We don't have as broad of a variety because we're all set on PEDS. So it's a little bit different for like family nurse practitioner where they are learning about different populations and subspecialties. So then that kind of more goes along with it, or ideally it does. But mine I started with just 84 hours, and then I've worked my way up to 168, which is like 2 days a week. That was the last couple semesters, and my final semester is a residency where I'm doing 3 days a week, and I'm kind of immersed in this as our focus. So grad school is a little bit different in that way, but again, every single even graduate program, master's, doctorate, they're all different. So you'll again have to check into that if you are wondering what each individual program offers, because they are different for different programs. So that's just how mine is. And so the point with the clinical experiences and your clinical rotations is it is all about you. This is a opportunity for you to use the information that you've learned and to apply it in the real world setting. So I want you to keep this in mind when you're going in, is that this is your time. This is your time to share with your preceptors, share with your instructors, share with if you're a new grad nurse or you're starting a new position. This also applies to share with your managers or your supervisors. Share with them what you need. This is your individual time to figure out what it is that you need out of your clinical rotations and what you need prior to graduating. And with this, keep in mind, you are not going to get everything you need out of your clinical rotations. I think there's this misconception that we think after I'm done with all my clinical rotations, or after I'm done with this one set of hours or this one rotation, that I am going to be ready to step into that role. That is not really the purpose and the design of these clinical rotations. It is essentially an introduction. You are never going to live up to your expectations if you have this idea that the second you graduate or the second you are done with these rotations, you are going to be ready to go, because that is not true for a certificate program. It's not true for LPNs, RNs, NPs, CRNAs. Nobody graduates school and is 100% confident and ready to go. It isn't realistic, and it isn't serving you to have that thought. It's adding and creating overwhelm and stress and anxiety about the whole situation. So this is your time to get the most out of it and to just absorb all the information that you get, and to take it forward with you, and to use this as a foundation, as an introduction to what is to come after graduation and throughout your career. So that is a great segue into kind of the second kind of main point I want to start off with is, so the first one is, this is your opportunity. This is your experience. So use it how you want, and let it be unique to you. And the second thing is, you are not expected to be an expert. Not now, not when you graduate, not in a year. Like, experts in the nursing healthcare profession are pretty far and few between, because it's ever changing, ever evolving. There's always things to learn. Yes, you are going to feel like an expert after quite some time, but even the so-called experts in this field are constantly learning. So I want you to keep in mind that you are a novice when when you are stepping foot in those clinicals, when you are stepping foot into your first day as an RN, you are still a novice, and that is what they expect out of you. You cannot go into your clinical so nervous and anxious, feeling like that you have to be this expert, or you have to know all your lab values. You have to know every disease and every management plan and every intervention and every medical term. Like, no, that is not what a novice is, and that is not what is expected of you as a student or as a new nurse, because it is so much of what your clinical rotations is in your nursing education in general, is introducing you to the profession and starting to allow you to gain these clinical skills and to utilize them. So keep this in, don't even keep it in the back of your mind. Keep it in the front of your mind when you step your foot in that door of the new unit that you are doing your clinicals in your new job, because it is what makes it so nerve-wracking. Like, even as a graduate nurse, even as a nursing student for nurse practitioner, I feel this. I get this feeling and this overwhelm all the time, because you have this idea that because you've been taught all these things and you've taken X amount of credit hours, that you're expected to be this expert. That's not realistic. This profession is all about lifetime learning. You are constantly going to have new policies, procedures in place, because guess what? The literature is always changing. There's new research, there's new guidelines, there's new ways of doing things. So you're constantly going to be evolving, and it's not expected of you as a student to get 6 hours a week or 3 hours a week of a class, and then all of a sudden, guess what? You're an expert at the topic. Nope, that's not what's expected, and it's not expected after 13 weeks or 15 weeks or however many weeks it is that you go to clinical, that all of a sudden you are an expert at inserting Foley catheters, or you are an expert at managing diabetes. That is not what's expected of you. So we have to drop that expectation and that misconception that we place on ourselves that we have to be an expert when we show up. Nope. So that is going to be so freeing to you, and it's freeing to me as a nurse practitioner student, because I still go to clinical and I'm like, I should know this. I should have the dosing memorized, or I should have this treatment plan in my head, where that's not realistic, because guess what? I'm a novice. I'm novice even as a nurse who's practiced for several years already. I'm stepping into a new role, and I'm still a novice even in my new job. Every time you start a new job or you transition into a new specialty, you're starting over, and that's good. That's exciting, and that's what's so magical about this profession, is that we have these opportunities to play this continuum of novice to expert over and over and over again. So that's what challenges us, and that's what keeps us passion, or gives us passion in this field. And so let that be a really strong reminder to you when you set foot in your clinical rotations, is that you are not expected to be a novice or to be an expert. You're expected to be a novice. So when you're going in, keep this in mind. It'll really help you out, I promise. So let's talk about going into this clinical. So the first step for you've started your clinical rotations and you don't know what to expect. Right? It's a scary feeling to start somewhere new, or to show up for the day to be with a new preceptor and just not know what's going to happen throughout the day. So the best thing that you can do for yourself, and the first tip I'm going to offer to you, is be ready and open to anything. Be open to the fact that you might be in a unit that you're not super passionate about. Be open to the fact that you might be with a clinical assignment. You might have patients that you're not too thrilled about. Be open to the fact that maybe you might show up and there's not going to be much learning going on. As far as, I've had days where I went to clinical and there was hardly any patients. There was days when we went to our peds rotation or our med surg clinical, and there was like 2 patients for 8 of us students. And you know what? It's okay. Be open to it. Take that opportunity to get as much out of it as you can. And hey, if you're not busy doing patient care, use that quality time to do your own research on the side, which I'll be talking a little bit about later. But be open to anything. This is a really big barrier that students place on themselves, is that if we're in an area that we aren't passionate about, or that we don't have interest in, or we think we're already know enough about, which is not accurate, we set the tone for the day, to be honest with you. So we are shutting ourselves off to learning. We are creating a bad vibe between us and our preceptors, and it isn't serving anybody. So be open and ready to just take in any experiences as they come your way. And remember that you are in the learning phases. So every single clinical experience, every single patient, every single nurse has something to teach you. You are going to get, I promise you'll get something out of every single clinical shift that you go to. So be open and ready for anything.
Friends, starting a new position is scary. It's frightening, it's overwhelming, it's exciting, it's all of the things. I know, I've started many new positions in my time as an RN. But really, it doesn't have to be as difficult as we try to make it. Through these experiences, I have gathered 5 tips to starting a new position and making that transition as smooth as possible. I have created a free guide for you as my listeners to make this transition as seamless as possible and allow you to really excel in your new position. So if you recently started a new position, you are going to start a new job, or you know someone who's going to start a new position. I mean, come on, you have to fall into one of those 3 categories. Then head on over to thenightingalepodcast.com to sign up to receive your 100% free copy of the 5 tips PDF. I'm here to support you through all your new ventures in your careers, and I believe these 5 tips are going to do just that. So head on over to thenightingalepodcast.com after this episode and download your free guide. I mean, come on, what do you have to lose?
The next thing that I kind of want to talk about is just your relationship with your preceptor and how this dynamic works. So I know as a student, especially in an undergraduate or a certificate program, you're a lot of times not with the same preceptor. I love the programs that you are, and you're, especially within your final clinical, a lot of times you are scheduled with one specific nurse, which I think is a lot more realistic in learning style, because that's what you'll be doing when you're done. And when you're training and doing your orientation as a new nurse, is that you will be more on a one-on-one, or you will be paired with a couple core nurses, which will allow you to really grow and to express your needs, and they can really gauge what it is that you need additional help with. But as far as any clinical preceptor dynamic, I want you to remember to just give them some grace. I think it's really one of our biggest anxiety provoking things is just our ritual of going into a unit and not knowing what to expect. I don't know how many of you are with me on this, but it is very daunting as a student to go in and be paired with a nurse for the day. And sometimes we get amazing preceptors, and sometimes we maybe get not so amazing preceptors, or we get preceptors who are having a rough day or who may be projecting kind of negative attitudes about the fact that they have a student. So offer them some grace and really just turn it around to what can you do to serve them. So this is one of my greatest tips with working with a preceptor and being in that student role is not only are you there to get the most out of your experiences and to really to grow in your professional skills, but you are there too as a sidekick essentially to them. So if you are viewing yourself as a burden and you are continuing to just feel like you are this shadow of theirs and you have nothing to offer, that's really what you're going to be for the day. So if you have this mindset that, oh, you have nothing to offer, blah, 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 and if you're just gonna kind of mope around with them and to feed into that negative vibe, that's exactly what's going to happen with the whole rest of the shift. So flip that around and see what you can do to serve them and to be not only their shadow, but be their sidekick. Be there. Not only are you going to get your clinical experiences and more autonomy and more experiences in general out of that day, you're going to actually help them. And how awesome is that feeling when you feel like you're supporting that nurse? Have you ever had that where you, even in a non-nursing job where you're done with your shift and someone just thanks you? Like that feels awesome. So if you can do that as a student and you can set up that relationship in a positive way, that you're not there just to take from them, but you're there to give back and to offer your support, that is going to make your learning experiences so much better. And guess what? That's also doing a second thing at the same time. That is setting you up for a good reference. It's setting you up for a potential job. It's setting you up for someone to vouch for you and say, hey, they're really a good student. They're a really valuable member of the team. I think that we should hire them onto the unit. So keep those things in mind and don't have this attitude of what are you going to give me? What are you going to offer me? No, what can you give back to them at the same time? That's really how we create this great partnership relationship between a preceptor and a student. So be there to offer your support to them. And again, they know you're a novice. They know that there's not going to be a ton of things that you can do, but let me tell you, there are a ton of things that you can do. You can help answer call lights. You can, even as a brand new student, your first day, you can go answer call lights. You don't have to respond or do whatever that patient is asking for, but guess what? You can bring it back to that nursing assistant, or you can bring it back to your nurse and say, hey, this is what they need, because at least you're offering that attention to that patient and you're beginning to see how that process works. So find things that you can offer for them. Maybe it's ordering a patient's breakfast. Maybe it's running a med or picking up a med from pharmacy, or there's so many different things. You have to keep your mind open to how can you serve them. And so if you do start your day with a nurse who is maybe not too enthusiastic about having a student, I bet you anything you'll be able to flip that around by offering how can you serve them. So start your day off by saying to them, what can I do to help? How should we proceed? How should I organize my day to help you? Because you're doing that too. That's a perk of being a preceptor too. And you will get so much more out of it. So that's a really great way to set a good foundation and a good relationship with your preceptors, is see how you can help them and what they need from you to get through this shift and to get the most benefit for both of you. So again, start your day off asking what you can do for them. What they expect out of you is a great question too, as far as especially for grad school. Do they expect you to go see patients on your own? Do they expect you to see every other patient? Do they expect you to interact with the patient as far as doing a physical exam? Setting those intentions and those expectations at the beginning of your shift is a really great way for you to set your tone for your rest of your day. So that's a really great start to building this relationship with your preceptor and getting the most out of this experience. So the next topic that causes a lot of stress and anxiety with clinicals is the dreaded topic of asking questions. So it is really scary, I know, to ask questions, to put yourself in a vulnerable position that, oh, maybe you don't know something, or just not being comfortable with your preceptor to ask those questions. So that's kind of the first thing that you need to assess when you have questions that come up is this a preceptor that you feel like you can ask questions to? Is this a preceptor that you're comfortable asking questions to? If not, maybe you are more comfortable saving your questions and asking them to your clinical instructor. So your clinical instructor should be there for you. Maybe they're not there all day, or maybe you only meet up at the end of the day. So save those questions for them if you really don't feel like you can ask those questions of your preceptor. So another common problem that comes up is you don't know when the right time is to ask these questions that come up, or you're like feeling that you're a burden for asking these questions, or you're silly or dumb or whatever thing that you're telling yourself that you're this thing for asking this question. And again, you have to go back to reminding yourself that you are a novice. First of all, I've said this in previous episodes. First of all, they expect you to have questions. Like, your fact that you have questions shows that you're interested, you're engaged, that you're critically thinking. It's a good thing to have questions. Like, don't tell yourself it's a bad thing. Like, no, you're a novice. You're going to have questions. You should have questions. And you just have to kind of gauge when the right time is to ask those questions and who's the correct person to ask them to. And again, is that your preceptor, or is that your nurse you're working with, or is that your clinical instructor? So who is that person? And so as far as when is the best time to ask these questions, you've got to figure this out with your specific situation. And there's not a perfect time. You will just have to gauge what works best. So if your preceptor is one of those people that is really frazzled or stressed out throughout the day, or maybe you have a really busy patient assignment and your asking of your questions in the moment is going to throw them off, then that's okay. Save them for later. So write down your questions throughout the day. If you don't think you need to write them down, put them in the back of your mind and just note them so that you can, at the end of your shift, say, hey, I have some questions. Do you have time to go over these questions? If they don't, write them down and maybe they can go over them at the next shift, or maybe that would be better answered by your clinical instructor. So write down those questions and feel out that style. Maybe your preceptor is one of those people that if it's in the moment, they feel like it's easier to answer your questions rather than waiting to the end of the day when they're trying to kind of wrap things up. So if you find that, and you can ask them too, say, hey, if this is another one of those setting the tone for the day, asking them if it's every day, if you're with a new preceptor, if it's the beginning of your relationship and you're with the same person, set that tone and say, hey, what do you prefer? Do you prefer that I ask you questions as they come up throughout the day, or do you prefer that I write them down and kind of note them so we can go over them at the end of the day or at the end of the week? What is your preference with this? And it is always a good thing to ask questions. And with the questions, it's really important as a student and as a new nurse and as a continuing nurse, figure out which questions require you to ask your preceptor, or good things to ask your preceptor, or what things that you can look up on your own. So as I said, we are lifelong learners with this profession. So we have to know where to find information. And so with these questions, it's important for us to know, hey, should I ask my preceptor? Should I ask my clinical instructor? Or should I figure it out myself? And should I dive in? And we're going to talk about that in a second. But we've got to kind of ask those questions first. And the biggest point here is don't be afraid to ask those questions. It's a good thing. It's a good thing to clarify. It's a good thing to walk through that process and to acknowledge maybe you think that something should be done one way and it's being done another way. It's a good thing to even just ask that in a good way rather than saying, oh, you're doing this wrong. Like, ask that question so that you can get that process and their explanation of why they're doing it, because they might have a really good reason. And this is something that we will see over and over again, is that we're taught one way in school and then we're seeing it done differently in practice, in a different way in practice. So that's a great opportunity for you to ask those questions and clarify things up a bit. So don't be afraid to ask those questions. It's good to have questions, but figure out that style. When should you be asking? And figure out, is this a question that deserves my preceptor's response, or is it something that maybe I need to figure out on my own? So that kind of brings me to my next point, is part of you being a student and your clinical rotations is you have got to be a self-guided learner. Like, we have to take it upon ourselves to get the most out of this experience. Again, it's ours to take. It's our unique experience to get what we need out of it. So what does that look like? So again, with the questions, so say you have a question come up and you're like, oh, maybe I could kind of figure this out on my own. So my suggestion is, when things come up that you do not know, or if I'll hear about a diagnosis that I've never heard of, if I hear of a guideline that I really am not familiar with, I go home, write it down, and go home and look it up. So we, again, need to get in this process of knowing where to find information, because as a nurse throughout your career, as a provider, you have to know how to find out those answers yourself, because you're not always going to have someone there. And you might not always have someone that's offering you the correct information. So go home and look it up. Find articles, find great resource websites, and look up that information on your own when you get home. And I found for me that looking it up, and even if it's a topic that you discussed with your preceptor, they answered a question, if you're still not really understanding it fully, go home and look that up on your own and just reiterate. And that really, for me, and everyone's learning style is different, but that allows me to really retain information, is when I go and look it up myself afterwards and dive a little bit deeper into this. So how do you do this? Or like, what sources do you use? So obviously, as your education gets extended, you use different sources and things, but a really thing that I love using is UpToDate. And this is by no means an ad for UpToDate, but UpToDate for me has, especially in my graduate degree, has gotten to be such a reliable resource for me, because it offers information that is really concise and it's up to date and accurate. Otherwise, go ahead and look up the information in your textbooks, your resource materials, go online and look up a research article. I know, especially for me in pediatrics, I've grown to love the American Academy of Pediatrics, and they have a lot of great resources available through them. So there's always that information out there. So go home, be a self-guided learner, and look up these things that you don't know, because it will help you retain it so much better than just someone else sharing with you about the topic. So The next kind of thing with being a self-guided learner is we have to express our needs. We have to share with our preceptors, with our clinical instructors, what we are needing. So if you are someone who has not gotten the opportunity to pass a lot of medications, you want to go to the operating room to watch a procedure and you've never gotten to do that, or you want to insert IVs or fill in the blank, you have got to speak up and create your own learning opportunity. So whether this be at the beginning of the day with your instructor or your preceptors telling them, hey, I'm really looking for this experience today, or if you could let your charge nurse know that I'm needing this experience, and they'll pull you in and they'll get that experience, but they don't know unless you speak up and share that with them. So share that with your preceptor, your instructor, anyone who might be able to help you out with that. And another thing that kind of goes along with this is we have to share our interests. So if you are in a nursing unit that you are loving, or you are wanting to do, say, emergency department and something that you're interested in pursuing when you're done, then again, share that with these core people, because not only is that going to share with them that that's your interest and that might be able to help you with job placement in the future, but it's also going to help you get the most out of these experiences and what you truly are needing. So I hope that these are things that are really going to set you on the right path to having a great clinical experience. Remember, coffee is your best friend. If you don't like coffee, tea is really amazing. Lots of sleep, being prepared, and like I said, just giving yourself that grace and the opportunity to just go in and soak up this time of being a novice, because it really is, it's your opportunity to learn. And again, the best thing that you can do to put yourself in the right mindset is stopping this comparison game right now. You aren't there to compare yourself to a nurse on your floor. You're not there to compare yourself to another student. Each and every one of us has our own nursing journeys to share with the world, and we all are at our own learning speeds. We all are going to get our own individual experiences, and as the amazing Rachel Hollis says, other people's opinions of you are none of your business, and neither are the opinions of your classmates who think that this comparison game is going to give you a head start in life or in your nursing career, because it's not. It is so much more beneficial to go into this with purpose and to just soak it all in. So I hope that you all have a great clinical experience now and in the future. And remember that you have a whole community of nurses that are here to support you. And if you ever need any guidance or encouragement in this field, you've got people behind you and who've got your back. So thank you all for listening. I hope that this has been beneficial to you. I love doing these solo episodes, and I welcome you to continue to offer your feedback on topics that you would like to hear about nurses you'd like to see on future episodes. And again, if you've found this episode to be beneficial and you have someone that you think would enjoy it too, go ahead and take a screenshot and tag them in social media and just get the word out there so that other people can have a really, really great clinical experience too.
Thanks for listening to this week's episode of the Nightingale Podcast. If you enjoyed this week's episode, make sure you subscribe so that you are getting weekly notifications when the new episode comes out. And while you are there, I would really appreciate you leaving a review, and maybe your review will be featured on an upcoming podcast. You can check out all episodes at thenightingalepodcast.com or on Facebook at The Nightingale Podcast.